Escape Pain is a rehabilitation program aiming for people who have osteoarthritis in knees and hips. It's a free program. It runs for 6 weeks. It's 12 sessions in total, and it runs twice a week for an hour, and it is a combination of exercise and education. So it's a unique combination of raising awareness and teaching people a little bit more about condition itself and teaching them how to manage that better.
People living with joint pain of 3 months or more duration can lead them into a very vicious circle of pain. So naturally people become more sedentary because they have pain in the joint. They reduce their general fitness, they gain weight, they become more stressed and anxious because they're in pain, and then leads to social isolation. So if we can break that circle and get people more active and teach them how to manage their pain, it has a huge effect on this group of people. Escape Pain has been hugely important for Newcastle and Gateshead. We approximately receive over 600 referrals over a 6-month period for this group of people. It also reduces the number of referrals into secondary care, and hopefully in the future will reduce the number of joint replacements that are needed. Even if someone does go on to have a joint replacement, we know that exercise before having an operation will help in their recovery and their outcomes will be a lot better. Over the last 12 months we've delivered 13 groups of escape pain, with an estimated saving of nearly £100,000 to the health and social care sector. So obviously in today's climate, that's hugely important to the NHS.
I'm out today, I'm out tomorrow, and I'm out on Saturday. Now a couple of months back that would have been unheard of, and it's just through coming here. I'm going to see River Dance on Saturday.